Hello and welcome. I'm glad you could join me tonight. We're going to talk about a very interesting medical procedure called Deep Brain Stimulation, or DBS. You may have been reading some about it. It's an exciting, rather new treatment for Parkinson's and a few other conditions. And with me to talk about this is Dr. Okeanis Vaou. Dr. Vaou's been on the show before. She's one of my favorite guests. She's going to talk about DBS and about some of the research being done in this field. She is a neurologist at the Noran Neurological Clinic here in Minneapolis. She's also been the medical director of the American Parkinson's Association here in Minnesota. She specializes in sleep and movement disorders, and of course, Parkinson's is one of the things you work the most with. Well, welcome back.
Thank you. It's a pleasure to be back again.
You really pushed to get DBS as a treatment option at the Noran Clinic. Mm-hmm. And what about it, Dr. Vaou, intrigued you to the degree that you worked so hard to get this going?
So first of all, deep brain stimulation improves the quality of patients' lives immensely. Deep brain stimulation is an electrical stimulation of the brain, a continuous electrical stimulation of the brain, through that improves some of the symptoms in Parkinson's disease and essential tremor. So overall, again, the quality of the life of a patient improves in so many ways, and I've seen how that happens, and it's very rewarding.
I think when lay people think about surgery to the brain, we get a little nervous, a lot nervous, and it's scary, but yet it's not a terribly major surgery, is it?
That is correct. I mean, everybody gets nervous. I would get nervous if it was for me, and I understand why the patients get nervous. It is not a major surgery, but of course it does involve, it is an invasive procedure. However, it carries a low risk and is relatively safe. So the recovery time is very fast. It only requires one night stay in the hospital, and the patient gets to go home the next day. And that is the first part of the surgery. Then there's a second part of the surgery, which involves placing the battery, and that is occurs a week later. So I've had patients tell me that hip surgery, hip replacement is more, requires a longer recovery time than deep brain stimulation.
Can you describe just kind of briefly, and we'll look at some video later that will go into a little more detail, but what happens when the procedure is done?
So like I said, there's two parts of the surgery. The first part is placing the electrodes in the deep targets in the brain. What we call these targets control movement. So we have to place the electrodes in the best possible place that would control tremor, the so-called sweet spot. That involves the patient being awake in the operating room, because we want to see how the electrodes are impacting the tremor or the stiffness or the slow movements. And once the electrodes are placed, like I said, the patient stays overnight, gets to go home the next day.
That's great.
The patient comes in. It's an outpatient procedure. The battery is placed under the chest, and it's connected to the electrodes in the brain.
What part of the brain does it go into in terms of
It goes
the
very,
area?
very deep in the brain. There's a group of cells that control tremor. There's two different kinds for Parkinson's, a different one for essential tremor. So we have coordinates. We know exactly where we're going.
Not the frontal cortex.
No, it goes very, very deep in a cluster of cells called basal ganglia.
Okay. It's such an interesting treatment. I'm curious how long it's been around.
Well, it was initially approved, it was initially thought of or started getting tested in the late 80s.
So it's not brand new.
It is not brand new,
No.
no. It was approved in 2002 for Parkinson's disease. It's also approved for essential tremor and also for dystonia.
In a brief way, can you, I think most people know what Parkinson's is, but can you explain briefly what dystonia is and also essential tremor?
Essential tremor is, or familial tremor or benign tremor, usually runs in families. It involves tremors of both hands. Some have mild tremors, some have very severe and disabling tremor. So benign tremor is not my favorite term because it can be quite severe and disabling, and that's where if medications are not beneficial and treat the tremor, that's when DBS can actually treat the tremor very effectively. Dystonia is a different condition, totally different condition. It doesn't involve tremor. It involves constant contraction of certain muscles to the point that a patient assumes certain positions from the for that contraction of the muscles, which can be disabling.
So those are the three that you are using it for now. Are there other things out there? I hear some talk about a few other arenas that it might be useful for, but are they anything you can talk about yet?
Not at the moment. I'd rather not talk about what is not FDA approved.
So not FDA
still
approved.
Not
okay.
FDA approved. There are some thoughts about other disorders they're being looked at, but we don't have anything concrete at this point.
In terms of who benefits from it the most, in terms of Parkinson's, you can't use it right away with Parkinson's, right? And you can't use it at the end stages. So where's that window in terms of who can possibly be considered a candidate?
So this is a very good point because initially it was thought that deep brain stimulation is mostly for advanced patients, but by that time most patients might not be candidates. A patient is a candidate for deep brain stimulation as long as they don't develop dementia, or if they don't, as long as they don't have a disabling depression or anxiety. So now this is starting to change. It was recently FDA approved for earlier use of deep brain stimulation, earlier in the disease, up to 4 years after having the diagnosis or being diagnosed with Parkinson's disease. Once the medications are not controlling the symptoms that effectively, or if the medications such as levodopa produce or cause dyskinesias, which are these involuntary, constant movement, dance-like movements of the body or arms or limbs, that's when we usually suggest deep brain stimulation. Also, if we have side effects of medications, if we are using too many medications because the disease is progressing, then there's a ceiling where we can't really use a higher dose or more medications because we have side effects.
So the correlation with levodopa, which is the main drug you use, being less effective is a pretty big part of the decision.
I wouldn't say less effective. I would say more that it's just not enough. So we need to either use higher doses or more medications.
Okay.
And we see a fluctuation of the motor symptoms because that just medication alone are not enough.
Is there any age limit in terms of people that can have this kind of surgery?
Well, the age limit is not so important as to whether the patient, like I said before, has developed dementia, or if they have lesions in the brain, certain, let's say, if the brain, it doesn't look so healthy. That's something that would basically rule out someone from having deep brain stimulation.
So it's really looking at where they are as an individual, not anything related to age.
On the most part, yes.
In terms of people's expectations, it is not a cure. And do you want to say something about that, because I think it'd be very easy to think or to jump to that hope that, oh, if my symptoms are controlled, am I cured? Or can I be?
So deep brain stimulation, again, improves the quality of most patients' life. We have to think that, yes, it's not a cure. It doesn't delay or stop the progression of the disease. It just resets the clock. So once the patient is treated with DBS, deep brain stimulation, then the patient can start using less medication. The patient's symptoms will be, on the most part, controlled better, but not all symptoms. We're talking about tremor, we're talking about stiffness, and slow movements.
It not the shuffle,
no,
which is a common thing that goes along with Parkinson's quite often, not always.
Not the balance, not the slurred
balance.
speech, not dementia or depression.
But the tremor, which is huge.
It is, and the slowness in movements and the stiffness,
and the rigidity.
Stiffness, the rigidity, so-called rigidity.
I've heard that, often people have a real hard time just getting up in the morning because of rigidity and getting going and getting out, so that might be very possibly changed.
So deep brain stimulation does exactly what medication do, without the side effects.
And without the side effects. Now, that's what's so intriguing to me. How many new, medications or treatments are without side effects? I mean, very, very few, right?
Correct, yes, yes.
Well, we're going to take a look at a clip that is short, but it's helpful because it shows a person who's having severe tremors before the procedure and then afterwards, how that changes the outcome. It also shows us some more and illustrates what Dr. Vaou said about just where the leads are put in and how that works. So we'll take a look at that clip and then be right back.
People suffering from ailments like tremors and Parkinson's disease rely on deep brain stimulation as a treatment option. And now researchers are exploring whether this same method can be used to treat everything from depression to disabilities caused by strokes. Deep brain stimulation, or DBS, is designed to use electrical currents to target abnormal brain activity. The method triggers blood flow and a series of chemical reactions that leads to the release of neurotransmitters. Together, these actions help correct malfunctioning connections in the brain. This is how DBS works. A neurologist and other specialists fuse MRI and CT scans of the patient to map out and hone in on the location of the brain that will be targeted. Doctors then surgically implant electrodes on the targeted areas of a patient's brain using a thin probe called a lead. A wire attached to the lead runs through the head, neck, and shoulder under the skin to the chest area, where it attaches to a battery-charged pulse generator that initiates electrical impulses. Then doctors turn on the lead, sending an electrical current to the brain. The patient, now awake, may be asked to move an arm, for example, so doctors can ensure that electrodes are precisely placed. A few weeks after the surgery, the patient visits a neurology specialist who programs how strong of a pulse the device delivers, how long it lasts, and how many times per second the electrical pulses are delivered. Once the DBS device is programmed, it delivers continuous electrical stimulation day in and day out. Doctors tweak the voltage and other settings depending on individual patient profiles and what DBS is used to treat.
I'd like to ask you, the results were so obvious so quickly with that man that we just saw. Does it actually, is there that immediate change in movement?
It's fascinating. The answer is yes. So if that electrode is placed to the right target, as we say, the sweet spot, then yes, we do see that immediate benefit, immediate control of tremor or symptoms, whether that's slowness or stiffness, just by turning it on and just ramping up that voltage.
And so is that done in surgery with some way that the patient can respond and listen? And I've heard some about that. Tell us about that.
Most people's surprise, the patient is awake when the electrode is being placed inside the brain. The brain carries no pain receptors, therefore there is no pain involved once the electrode is being placed into the target of the brain that we're looking into. And the patient has to be awake because we want them to perform some movements to see whether the electrode is actually in the right spot. If they have tremor, we turn it on and we see the tremor improve, or we ask them to do a few repetitive movements to see if they're more efficient, if coordination has improved. And there are some centers that are starting to do the surgery while the patient is asleep or is being under anesthesia. But most centers have the patient awake.
That is, fascinating. The risks for surgery, there are some. You've had wonderful success with your patients, but tell us some of the things that a person should be aware of that could go wrong.
Of course, we shouldn't forget that this is an invasive procedure, and like all invasive procedures, it carries its risks. The good news is that compared to the past, the risks are much lower than what they used to be. We're talking about 1 to 2% risk of troublesome bleed in the brain, or disabling bleed in the brain, or an infection. So 1 to 2% is the risk, and considering the benefit, it's definitely quite a low risk.
So most people, when you tell them the possible benefits versus the possible risks, I bet they're not hesitating too long.
Not too long, but some do, and I appreciate that and I understand that. So I try to make it as more apparent and for them, and try to help them by talking to patients who've had the disease, the procedure, get as much education as they can.
Can you tell us, we only have about 8 minutes left, but can you tell us a short story about a patient that really did benefit, and sort of to make this real for us?
Well, that's hard for me to do because I would love to tell you about all my patients.
They all would love to probably be
I know.
showcased too, right?
I have a couple of good stories to tell about both essential tremor and Parkinson's. I had a Parkinson's patient who the medications were really not as effective to treat his tremor. He had his predominant tremors, Parkinson's disease, so he mostly had tremor. Young man in his 50s. And we had to use very high doses of levodopa. Of course, that led to dyskinesias. And we were kind of struggling because his tremor was not very well controlled. So he had deep brain stimulation. And at that time, just by medication alone, because he had tremors still, he was struggling at work. And he was almost to the point where he was thinking of retiring, early retirement.
Because of
the tremor.
His tremor.
Yeah. So after deep brain stimulation, his tremor was completely gone, to the point that he decided to stop all his medications, and he did.
Wow.
His tremor did well when he was off the medications, but he had a little bit of some anxiety. So he went back on them, but very, very, probably like 20%, almost half of what he was taking before. And he's doing great. And he's doing very well at work.
So he didn't have to retire?
No, he didn't. He did not retire. Yeah.
Well, that's a great success story. And then there's one about essential tremor,
and
too?
with essential tremor, I have a lot of patients as well. The most moving stories are the ones that come from people who are professionals and are ready to retire because of their tremor. And then with DBS, their whole life changes. They're back at work. they can live a good quality of life, they can use it with their hands, and they can do things they couldn't do before. I had this patient who was a teacher. He was drawing. He used to draw decades ago, and he had stopped because he couldn't, given it up. And after DBS, he went back drawing, and he brought me nice pictures and drawings, and it was very moving. It was a wonderful moment when he had no tremor at all.
Yeah, those are the things that I would think as a physician and someone who helped get this happening, you would feel just so good about it. Are there neurologists around the state and country, though, that are dubious about DBS?
There are. There are.
So it's probably like most therapies. There are people who are for and those who aren't so sure.
It's how much experience you have. Some neurologists are treating people with DBS and some aren't, mostly movement disorders. Neurologists are the ones who will treat patients with deep brain stimulation because they treat patients with Parkinson's and tremors and essential tremors and dystonia. So you have to be more familiar with deep brain stimulation, what it is to feel more comfortable and get good results too.
Well, it's very, very interesting. It's so exciting. Are there some new things going on down the road that you can tell us about in terms of research with DBS? You had mentioned that to me earlier. And
it is very exciting because there's new little tools or gadgets coming out, possibly. There's research as to how to provide even better control with deep brain stimulation, how to get to that really good spot target that will give wonderful control of all the motor symptoms. There is a new target that is being looked at that might improve balance and walking.
Oh, that'd be wonderful.
There's also a new smart DBS that is possibly going to be developed and come out soon, and that will take a feedback from the patient's unique symptoms and brainwaves and send the electric stimulus as needed to control those symptoms. So it's not going to be a generic random a continuous stimulation. It will be more tailored to the patient.
That sounds good, doesn't it? I mean, more individualized.
It remains to be seen.
Would a patient realize the difference? I mean, I'm sure they would, but not having had that experience yet, of course they don't know what they're missing, but would it change things in a dramatic way for the experience of the patient?
Remains to be seen.
Okay. Well, maybe I can have you back in a year or two and we'll learn more about this. We have 3 resources we want to put up. The first one is the Noran Neurological Clinic, where Dr. Vaou works and where she has the Center for DBS treatment. That is noranclinic.com.
Correct.
And then we want to also put up the American Parkinson Disease Association website, because that is where Dr. Vaou has been the medical director, and it's also a great resource here in Minnesota. We'll put that up now. And then finally, we want to put up the National Parkinson's Foundation website, and you can jot that down. Well, thank you so much for coming down again and educating us and helping us feel more hopeful about Parkinson's treatment and essential tremor, dystonia. It's got to be so rewarding to be working in a field where the brain is being uncovered, in a sense.
It is.
More and more
It's fascinating.
every week.
It's fascinating.
Yes.
And I'd love to come to your show and tell you all about it.
Well, thank you so much. It's been great to see you again.
Yes, likewise.
We'll be back again next week. Until then, have a good week and check out the websites. I think you'll also learn about support groups. I just want to quick mention that here's a list of support groups that are offered, and this is something that if you do have Parkinson's or any of the other conditions she mentioned, support groups can be really, really helpful. So thanks for being with us. Bye-bye. Have a good week.